I sell wheelchairs here in Ohio. One of the things that we've been having trouble with lately is insurance approval. A lot of these Medicaid patients that we were getting chairs for, unfortunately, they switched to a little bit more of a private kind of insurance system. And with that, they tend to be denying a lot more of our claims. So we never know what the landscape is going to look like 5 years from now. So what I've been trying to do lately, especially with my long-term care patients, is to sort of future-proof their chairs a little bit. And this is what I'm talking about. My name is Tim from Stride Mobility. I'm the Ohio wheelchair guy. I'm an ATP here in Ohio. But what you'll see a lot of in the wheelchair space for most of the patients is something like this. It's a foam style of cushion. It's going to be the same with the backrest. A lot of them are going to have foam on them. A lot of them are going to have either a molded plastic backplate or a metal backplate. And that's good. That's great for a person in a specific moment of time. But the unfortunate thing is that we see these patients in just a snapshot. For the most part, insurance is going to cover a new custom wheelchair every 5 years. Sometimes within that amount of time, like 2 years, they may allow for some custom seating, but not always. It doesn't always get approved. And so what I've been trying to do is set up a patient's new custom wheelchair in a way that's going to allow the therapist or the caregiver to really customize that experience as they go, in the case that maybe 5 years from now, they won't be approved for another custom wheelchair. We just never know what's going to happen. So because of that, I've been doing a couple different things. What you'll see here is called a Caligon bonder. This is a 3D printed backrest, which is really great because these laterals here, just this design, I can sort of shape it how I want. They do have a system on their website there that I can kind of see the 3D printed model before I click OK. And what that's going to do is help me determine exactly how I want the patient's laterals to go, if they need laterals at all. This right here is another model by Matrix Seating USA, and this is actually a molded model. You can see it's got sort of a weird design there because for this one specifically, it was probably a peds patient, and so they had some significant spinal deformities. And so what we do is we 3D scan the patient, we send it in, and what they do is essentially make the mold to allow the patient to have a little bit more upright sitting, because we want them to be able to interact with their environment as much as possible. And in order to do that, normally they want to have just an upright sitting alignment. But this also is 3D printed, so that's what's really nice. And this is why I love the 3D printed stuff. When I make this backrest, I take very specific measurements to see exactly what I want on the patient. But again, that's only for a specific amount of time. It's only a snapshot of the patient's life. 5 years from now, they could gain weight or they could lose weight. And so what I like about these is that because they're 3D printed, what you can do is go on the inside, take some of the internals off of it, take a heat gun, and you can mold these wings, these lateral wings, in or out. So say a patient has dramatically lost weight in the past 5 years, which is a very common thing that happens. But unfortunately, their insurance has denied another custom wheelchair. Well, if that happens, I work with the therapist to sort of fix this problem. If they have a backrest like this, again, I will go in, I will heat these areas here, these wings here, and kind of move it in so it hugs the patient a little bit better. So that's the freedom I have with that. But not also that. Let's say their lateral lean has gotten very severe. Let's say I've made this backrest and they're really leaning into this. And unfortunately, it's getting up under their armpit and it's really making it uncomfortable for the patient. One of the things that we can do with that is we can just take a saw to it, essentially. We could take a saw, kind of grind that down, cut that part off, put the foam back, and the patient now has a lower lateral that isn't digging into their armpit if they're not able to get a new custom wheelchair or custom seating. It gives the patient a little bit more leniency, because again, we never know what's going to happen 5 years down the road when it comes to insurance. And even though it's plastic, it may seem kind of funky, but this stuff is very, very sturdy, very strong. And I'm a strong dude. So if I can't break it, nobody can. That's not true. I'm not that strong. Maybe in my prime. But another thing that I've been trying to do is the same with the cushion. See, this here is from Matrix Seating USA, sort of the same thing. This feels like a foam cushion, but it's actually, this is a 3D printed cushion as well. So you can see it does give like foam. I make it custom. So I've got the laterals, I've got the medial abductor, and we can make it softer or harder as necessary. Now here's what's really cool about this though. Let's say the person is having some issues with like a sore spot here, or maybe a wound up in here. One of the things we can use is just this electric knife and just cut out a little piece. Or let's say their legs have started to come together and this abductor is not doing a great job. We can cut that off, and so really we can modify that on the fly. We just need something like this, or let's say they just need it a little bit softer in a specific area. One of the things that we can do is just take a utility knife like this, cut it out a little bit to allow for a little bit more release in that specific area. It works really well back here. Let's say they've got a sore spot on their right IT. We can just cut it up a little bit, just kind of allow for a little, yeah, you can offload that specific point there, and with the cover on it, it's going to provide that offloading that maybe is going to be helpful for the patient. And you just never know what's going to happen with these patients. We can put them in a chair and then in 2 months they could gain 20 pounds. I mean, that's unfortunate, but that's just the reality of the situation. And with insurance going the way it's going, I want to make sure that I give my therapists that I work with, or the caregivers, the education and the tools that they need to get these patients what they need and where they need it, and adjust them appropriately, and not have to worry so much about things like wounds or things like positioning, independence. It gives the client a little bit more freedom, and it gives the therapist a little bit more knowledge to bring that freedom, because ultimately, especially in a long-term care facility, patients want that freedom. Patients need to have a little bit of that freedom because they're in that facility. They have a very difficult time leaving, and they don't have a lot going on all the time. So the more freedom we can give them, the better, and that is ultimately my goal when it comes to wheelchairs. I want the patient to be able to go where they want, do what they want. I just know that when I was a therapist, it was difficult seeing these patients struggle so much with their mobility, with maybe being uncomfortable. And I know that with this job and with all the utilities that we have, we can make a patient's life better almost instantly. We get them in the chair and instantly their quality of life goes up. So that's the reason I want to use sort of the latest and greatest technologies in the wheelchairs that I get people, because you never know what's going to happen 5 years from now, and I want to be able to make that wheelchair work for as long as possible. Thanks for watching. Subscribe if you enjoy it. I'll see you in the next one.